Good afternoon, everybody. Today I am going to discuss one of the very important topic, and that is development and assessment of development in children. Now, we all know that child has got a unique capacity to develop in due course of time. Now, what does this development mean? Let us see that the acquisition or acquirement of newer and newer functions over a period of time, which is nothing but a qualitative improvement in the functions of the child, and that is occurring consequent to the maturation of the various organs, and most important is the nervous system. So, maturation of the nervous system leads to acquirement of various developmental milestones in a child, and this particular whole process is called as a development in a child. Now, in this particular topic, what are the principles of this development, that we will discuss. Then what are the factors which control the development, and third, what are the age wise achievement of the milestones, that we will discuss. And last but not the least, we will see how to say assess the functions in a group, like say motor functions and other functions, and what are the various say domains of these developmental milestones. And if at all, last but not the least, will be the various tests which are being used by psychologists in assessment of the child's developmental quotient and the intelligence quotient. Now, coming back to the principles. Now, what does the principle of this development mean? It means that the first and the foremost, it is a continuous process. It is not a stationary process, it is a dynamic process, it is a continuous process, and this starts right from the time of fetal life, the period of conception to the attainment of maturity. By the time the child is completely mature, that is called as adolescence. So, from conception to the adolescence, this is the period wherein you get these developmental milestones getting acquired by the child over a period of time. Now, the sequence of development is unidirectional. That means that in one direction only the milestones are achieved, it is not a reverse way. Only thing is that there are certain phases where you get waxing and waning of these milestones, and occasionally single milestone may be escaped and this particular or skipped. So, the rate of development varies from child to child, and sometimes the occasional milestone may be skipped. Development is always in an orderly fashion, and one skill or development precedes the another in a particular sequence. This particular sequence is followed throughout the period of childhood. Now, what is this sequence? Sequence is always in a cephalocaudal direction. That means the part of the brain or the head, that is being achieved, the development is achieved first, and then the lower system, that means the limb movements, they are being attained in this particular direction. So, the first step towards walking is the development of the strength in the neck muscles and head control. So, first a child should attain a head control, he should be able to sit, then only he will be able to stand and walk. So, this sequence, what is it called as, is a cephalocaudal direction. The infant can do much with his hands before he can walk. He can crawl, pulling himself towards forwards with his hands before he can creep, and using the hands and knees. So, primitive reflexes with which the child is born in a fetal life, that are to be lost over a period of time, say for example, in the first 3 to 6 months of life, and then it is replaced by the newer and newer skills. There may be a difference in the rate at which milestones are achieved, and occasional milestone may be skipped, which I already said, but the sequence of acquiring milestone is always a constant one. Now, this particular slide shows you that what is the size of the fetal brain, what is the size of the infant brain, and when the child becomes 5 years old. So, progressively we find that there is a increase in the size of the head over a period of time, and this is along with that there is a say physiological development occurring in this nervous system, wherein you find first of all there is a multiplication of the cell, and then there is a hypertrophy, then there is a development of synapses, then there is a development of myelination. So, this sequence goes on increasing. Similarly, at birth you find that if you compare with the adult brain size, you find that the 25% is present right at the time of birth. The size of the brain is almost 25%, and by the time the child is say a 1 year old, he almost has attained a 85% of the brain size, and by 3 to 5 years of age we find that the child's brain is almost 92%. So, brain development occurs in the first 5 years of age, and this is a very critical phase of brain development. Any insult occurring during this phase can lead to developmental retardation. So, this is very important thing to understand. Now, this is what is being again shown over here, the right from the period of conception, birth, 4th months and adolescence, and these are the gestational weeks, and you find that first of all there is a neuro occurs, myelination takes place sequentially, synapse developing, and some of the system is getting apoptotic. So, all this particular phase is occurring in a orderly fashion, and this is very important for the development of the brain and consequently the development of the child as a whole. Now, this particular slide shows you what are the various domains which are developing first. You find that the sensory pathways, the vision and the hearing, that gets the say priority, and therefore, you find that these are the milestones which are achieved first. The child is able to focus at the mother, he gives a social smile, then he has got a achievement of the language. Of course, he has got the cognitive function, that means the capacity of abstract thinking, that comes later on. So, this is how this sequence of events occurs over a period of time. This is again being shown graphically in this particular slide. The vision has a priority, then the speech development, then the emotional development, then the logical system, that means the cognitive functions are developing, social attachment and skills, that is also occurring, and the first and the foremost the milestone the child shows is the motor milestones. He develops a increased tone, flexor tone in the full term baby, and the peer social skills, that means the relationship with the peer age groups, the friends, and then last but not the least the language. So, these are the various domains of development which the child has got, which the child has achieved. Now, coming to the again the weight of the child, weight wise you find that the child has got, say the x axis shows you right at the bottom you have got a newborn baby, then you have got a 4 months old baby, then the 8 months and the 12 months. Now, in this age group you find that the head circumference at birth is only 35, then becomes 40, 44 and then ultimately 46 centimeters. So, sequentially also the myelination, the posterior column and the spinothalamic tract, they are the one which are getting developed first, and then you have got the other system getting developed. So, this sequence is followed mostly right from the fetal life and thereafter after the delivering. And therefore, these various functions right from say rooting and sucking reflex for example, and grass reflexes, they are present right at birth. Then you have got a head control and rolling over and vertical graze and neonatal reflexes, they disappear by the time the child becomes 4 months of age. Then you find that the child at 8 months the child sits alone, crawls, transfer objects and reaches for the object, and then ultimately when he is 12 months old he has got a voluntary release, he is able to walk independently, pincer grasp is there and he himself pulls to stand and stands with support, or even without support he can walk about. These are the neonatal reflexes which the child is born, and these reflexes they are very much important in the newborn period for say the sustenance of the life. Say for example, rooting reflex or the say sucking reflex, these are essential for taking milk from the breast milk, and therefore, these are the reflexes with which the child is born with. As the age advances, these reflexes they disappear and then it is replaced by see parachute reflex and the Landau's reflex. This parachute reflex and the Landau's reflex is the one which helps in making a balance in the balancing of the body or the balancing of the posture. Oh, sorry. Yes, Can I see it here? Yes. So, the parachute reflex is one which is very much important for balancing, so that whenever child is trying to fall, he will take the help of the hands and try to support and try to prevent the injury to the head. So, this type of reflex is called as a parachute reflex, and these are developing after the age of 7 to 8 months, and it persists throughout the life. Now, what are the domains under which the child develops? These are the 4 most important domains. First and the foremost is the motor development. Motor development, what does it mean? It means that there is a gross movement of the limbs and the body. For example, the child is able to sit, child is able to stand, walk, run. So, all these activities come under the gross motor activities. The fine motor or adaptive movement, they are nothing but the manipulative movements, and the child is able to, say for example, hold certain objects, he reaches for objects, or he tries to hold the pencil, he tries to hold the cup, he tries to button, unbutton. All these skillful movements, they come under the fine motor movements. And then third is the language, that means the attainment of, say, the ability to communicate, say right from, say, cooing sound, then he goes for a monosyllables, the disyllables, the words, the sentences, the verbs, adjectives, like that. So, this is how the sequential development of the language occurs in a child. And the personal, social or personality development, here you have got a complex interplay of various skillful activities. First and the foremost is, say for example, social relationship skill. Say for example, the child when he becomes a 6 to 8 weeks old child, he tries to interact with the mother, he tries to develop a bonding with the mother and then demonstrate a social smile. So, a sense of attachment with the mother, and then as the age advances, he tries to mix up with his with other kids, he tries to play with the kids, and as the age advances, for example, in a preschool child and a school going child, he tries to play with the playmates. So, this is how a social relationship skill is attained. Then emotions, ability to appropriately express and regulate the feeling. Say for example, crying, then smiling, the laughing, all this and the apprehensive facial expression, gestures, all these activities, they come under the emotions, the management of the emotions, and these are the developmental domain which comes under personal social activities. Then self-help skills, the child able to feed himself. Initially at birth he is able to feed by sucking and swallowing from the breast and even from the bottle, but subsequently he has to feed himself with the help of the hand. So, which is attained by the age of, say, 10 to 12 months of life, and then thereafter he goes for a more skillful activities. Then ability to dress himself. So, initially he tries to help for dressing, then bathing also, toileting, bladder and bowel control, all these skillful activities, they come under social domains. Then the cognitive, cognitive means the capacity of thinking, and that to a abstract thinking and development of intelligence and mastery over the vocabulary and mastery over the language. All these things, abilities, they are collectively called as a cognitive domain of development. Now, hierarchy of the needs, as per the Maslow's theory of hierarchy, there are various hierarchies which we have come across. The first and the foremost is the physiological, that means which is very much essential for the day to day life of our body, and these are the air, water, food, shelter, sleep and clothing, for which any individual tries to or strives to get hold of these things. Without air, person cannot live, and same thing about the water and food. Then subsequent comes the safety needs, that means the personal security, then the employment, then the health, all these needs, they are the second priority. The third priority is the love and belonging, that means, say for example, bonding. For example, the infant and the child, then the family bonding, then the friendship bonding, and the school environment also, the bonding with the school teachers, and then esteem, that means self-respect. The child wants that he should be respected, he should be given some sort of respect, so that he is not being all the while being fired by any member, neither in the family nor in the outside. So, self-esteem, the recognition, the freedom, all these things are the requirement of the child. This is the fourth this thing, and last but not the least is the self-actualization, that means desire to become the topmost person in a society. So, that these are the various hierarchy of the needs which the psychologist Maslow has already described, and all these children, they have to strive for all these developmental goals. Now, coming to the average level of development at different ages. Say for example, newborn I will discuss, then at the age of 3 months I will discuss, 6 months, then 9 months, 12 months, then the 15 months, 18 months, 2 years and so on. So, various age groups, what are the various milestones under the 4 domains, that means the gross motor, the fine motor, the language and the social, psychosocial. So, coming to the at birth, you find that the preterm baby is not able to is born with a generalized hypotonia. She lies in a frog-like posture when in a supine or even in a prone posture. And there is a mass reflex. Whenever small sound is created, the child moves a lot. So, and the neonatal reflexes many times they are very primitive, they are not well developed and they are absent most of the time. In term baby on the contrary, you find that there is a increased flexion tone, that is universal flex posture, and the neonatal reflexes they are well developed in the full term babies. Then at the age of 4 weeks, you find that there is a in a ventral suspension, the head is held up momentarily and elbows flex, hips partly extended and knees flex. He has got in a prone posture, the pelvis is high, knees under the abdomen, head predominantly to one side. This is what is achieved at 1 month of or 4 weeks of age. Now, this is how the slide shows that the child when held in a sitting posture, pull to sitting posture, he has got a head lag at 4 weeks of age, and even in a when he is made to flex forward, he will find that the back is uniformly rounded. This is what is being seen in a 4-week-old child. Then in a 6-week-old child, you find that there is a asymmetric tonic neck posture. That means the side towards which the child's face is turned, there is a extension of the upper limb and the lower limb, and the opposite side there is a flexion of the upper as well as lower limb. This is called as asymmetric tonic neck reflex. This reflex usually appears around say 4 to 6 weeks of life and usually disappears by the time the child is 3 to 6 months of age. Now, then the grass reflex, then beginning to smile, all these are the milestones which are achieved at 6 weeks of age. Vision is there, but he follows only in a horizontal fashion, he can't follow in a vertical direction. Then he can, when he is held in a standing posture, sometimes he can demonstrate even a walking reflex, and he can turn even slightly towards the source of the sound. These are the milestones which are there at a 6 weeks old child. Right. This is what is being shown over here, the grass reflex, the social smile, the vision fixation, all these things is being shown. Now, at the 12 weeks, 3 months of age, there is a gross motor when head held up for a prolonged period. That means he has got a significant degree of the control over the neck muscles, and therefore, child is able to hold the neck in a vertical posture for a prolonged period. In prone posture, pelvis is flat on couch. Then pull to sit, only slight head lag is present, held in a sitting position, head mostly held up, but still bobs forward. So, if he is made to sit, and when his jerk is given, there is a bobbing of the head is there. And in supine position, no more ATNR. That means by 3 months of age, the asymmetric tonic neck reflex that disappears. Hands, there is no grass reflex, and hands loosely open. Child tries to vocalize and turns toward the sound at 3 months, and he squeals with pleasure. If somebody is say approaching him, he squeals with pleasure because he thinks that he is being taken up in the lap, and therefore he shows a pleasurable gesture. Binocular vision starts developing by 3 months of age, and he watches the movements of his own hands. By 4 months, almost similar thing, except that the head bobbing is not there, and he laughs aloud when somebody interacts with him. Now, at 6 months, 24 weeks, in a gross motor, the prone posture, the weight is held on the head of the child, hands of the child. So, child is holding his, bearing his weight on his hands. This is what is possible at 6 months of age, and he can sit when supported for few minutes, but in a standing position, almost full weight is on the legs. rolls prone to supine very well, hands hold bottle, he grasps his feet, cube, palmar grasp of the cube is there, what is being shown over here, the palmar grasp. Feeding, he drinks from a cup when it is held to the mouth, and play, he laughs when head is hidden inside. Now coming to the 32 weeks, he sits momentarily for few on the floor without any support, as it is being shown in this figure. He can be supported with one hand and he can stand bearing the weight. He adjusts his posture. He responds no to the social activity. He looks for drop toy and imitates the sounds. Speech, monosyllabus comes, but without meaning. Da, da, da like that, ba, ba, ba like that. But he does not combine the words at this 8 months of life. Now at 10 months, he has got a pincer grasp. He can crawl also, crawling is there, and creeping also develops in 11 months, and he can have a pincer grasp. This is what is called as a pincer grasp. He can hold the object with the help of the forefinger and the thumb. So that is called as a pincer grasp. This is possible at 10 to 11 months of age, and he can wave bye-bye at this particular age. Now at 1 year, in a prone posture, he walks like a bear. So on hands and feet, this is called as a bear walk. So this is possible by say 12 months of life. Walks sideway also, holding the furniture. He rolls ball to examiner, drinks from a cup like this, what is being shown over here, and 2 to 3 words with meaning, that means dada, baba, like that he can speak at this 1 year of age. 15 months he stands on the knees, what is called as kneeling phenomena, that is there, and without support. Creeps upstairs also, and builds tower of 2 cubes. Speech, there is a jargon speech which we cannot understand. He speaks fast, so that whatever, and his words are not so much intelligible. And dressing, he likes to take off the shoes. Feeds self, picking up cup, drinking, putting it down. He may kiss pictures of animals, imitates mother in domestic duties, and inserts round block without being shown, points to picture in book, or he points to the parts of the body. So this is how a tower of 3 cubes are being produced at 18 months of age, that means 1.5 years of age. At 2 years, he can build a tower of say 6 cubes, and he can build even a train, washes and dries hands. He picks up object without falling, he can run, but there is a tendency to fall at this moment. Kicks ball without overbalancing, turns doorknob, unscrews the lids. At 2.5 years, he jumps with both the feet, walks on tiptoes when asked, and tower of 8 cubes are being produced. Sphincter control is getting developed at this age, but not completely. Sometimes he passes urine in the nappies itself, attends toilet without any help except for wiping, begins to notice sex difference, male versus female. That difference is attained by 2.5 to 3 years of age. He knows his full name and knows also the sex, whether it's a male or a female, but that is well established by 3 years of age. By 3 years he can run, jump off bottom step, goes upstairs 1 foot per step. So these are all, and what is most important is he can ride a tricycle. He can dress, undress fully if helped with buttons, and he can manipulate, he can produce a bridge from 3 cubes, and he can produce a circle at the age of 3 years when he is being demonstrated. So narrates sometimes events and stories and nursery rhymes also as early as 3 years of age. At 4 years he goes downstairs 1 foot per step, skips 1 foot, and he can draw a cross of at 4 years of age. Manipulation, can button close and cubes, imitates gate, pencil, copies cross. He tells stories. Sphincter control is attained by this time. At 5 years, he skips on both the feet, Hopping is possible. Tandem gait, that means the heel to toe posture or walking, that is what is called a tandem gait, that is being attained for the first time at 5 years of age. Dressing, he can tie the shoelaces, copies a triangle. Triangle capacity becomes at this age, and understanding of age, whether he is a older one or a smaller one, younger one, he can understand that at 5 years of age, and distinguishes morning from afternoon and compares the two weights. Now coming to the factors, what are the factors which affect the child's development? First and the foremost is the genetic endowment with which the child is born. So various genetic factors, even the parental personality, parental lifestyle, parental say any lagging behind in their childhood, that also are passed on to the child, and these genetic factors make an effect on the child development. If genetic defects are there, then the child's definitely development is retarded. Several genetic conditions are there. Physical factors are there in the form of that the right from say he is being allowed to develop. Suppose the child is being not allowed to stand at all, then he will not be able to walk even at the age of 3 years or 4 years. So such physical factors are very important for the development of the child. Nutrition definitely has got importance. Emotional factors, of course, if the child is deprived of these emotions, say for example stepmother, step parents are there, or he is being nursed in a say in a hostel where there is no lot of emotional support, in that case the development of the child is retarded. Social cultural factors also has got a lot of importance in the child's development. Now coming to the various gross motor milestones in nutshell which are to be seen in a particular child. So at 3 months neck holding has to be there, whether present or not, that has to be seen. At 5 months rolling from side to side has to be seen. Initially he rolls from say supine to prone, and then from prone to supine. Then he sits with own support at 6 months, sitting without support at 8 months, standing with support and crawling at 9 months, creeping, that means on hands and the sole. That type of walking is possible at say 12 months of age, and even the bear's gait what we get is again at 12 to 13 months of age. 15 months he walks alone, creeps upstairs. 18 months he tries to run, walks upstairs and downstairs at 2 years of age. At 3 years he can ride a tricycle, and 4 years he hops on one foot, alternate feet going downstairs, and 5 years you get a tandem gait. So these are what the gross motor milestones being attained over a period of 5 years. Fine motor, 4 months he reaches for a object with both the hands. If somebody offers a object, he will try to catch hold of it. Reaching out for objects with one hand only by 6 months. Immature pincer grasp, it is not pincer grasp, by 9 to 10 months of age he gets a pincer grasp. Then by 15 months he imitates a scribble and tower of 2 blocks. By 18 months he scribbles tower of 3 blocks, and by 2 years a tower of 6 blocks, and vertical and circular strokes are possible. At 3 years tower of 9 blocks and copies a circle at 3 years. 4 years he can create a bridge with the blocks, 3 blocks, and he can copy a cross. And at 5 years he copies a triangle and a gate with blocks. Social and adaptive milestones, you find that at 6 to 8 weeks the child develops a social smile. By 3 months he recognizes the mother's voice. Even if the child is crying and mother is trying to console him from a distance with the voice, he will try to stop crying. So this type of recognition of the mother's voice, mother's face, that all becomes possible by 3 months of age. By 6 months he recognizes strangers, so that the examination becomes easier before 6 months of age. After the child becomes say 8 months, 9 months, 10 months, then he recognizes that this particular person is a stranger person, and a sense of mistrust is developing at this age, and therefore the child cries when any stranger approaches a child at this age. Then by 9 months he waves a bye-bye, then plays simple games by 12 months of age, jargon speech by 15 months, he copies parents' tasks and household chores by 18 months or 1.5 years. He asks for food, drink and toilet. 3 years he shares toys, knows full name and gender. By 4 years there is a group play, that means they enjoy the group play and goes to the toilet alone. By 5 years helps household tasks, dressing, undressing, all these milestones they are attained by 5 years of age. Language, at 1 to 3 months you find that the child alerts or startles or blinks to sounds, blinks eyes to sound when the sound is produced. Then by 3 to 4 months, just now I said, quiets to mother's voice, turns heads towards the sound source, laughs loud and coos, that means vowel sounds are produced. At 6 to 9 months of age, this is the period when you have got monosyllables, and by say 9 to 12 months of age, he has got a bisyllabus. By 12 to 15 months, responds to own name and says no, follows simple request, says 1 to 2 words with meaning and imitates same sound. By 18 to 24 months, 9 to 10 words vocabulary, uses pronouns like I, me and knows body parts. And by 36 months, that means 3 years, he uses 4 to 5 word sentences, understands verb for the first time. 4 years he says songs or poems and nursery rhymes and tells sometimes the stories also. Now, what are the various screening tests for developmental assessment? For newborn babies, based on physical signs, tone and neonatal reflexes, we can assess whether this is a premature baby or a full term baby or a post mature baby. So, this type of assessment is done right by physical examination, right from the skin texture, the growth of the nail, the hairs, the nodules, the genitalia appearance, all these things they help, and the tone also, the movements of the limbs and all those things they can, and neonatal reflexes. Then amentation scale is another scale based on the muscle tone, wherein depending upon the tone in the muscles, flexor muscle tone, we can grade this particular babies to a premature or a full term baby. For infants and toddlers, there are various screening tests. These are only screening tests, they are not confirmatory tests, but they help us in assessing a child, and if they are assessed for 2 times and if the same score is attained, most likely this particular child is either a normal or abnormal depending upon the score. So, Denver developmental screening test, then Indian adaptation of the same test is called as a Trivandrum developmental screening chart, then Gesell's developmental schedule, then Bailey scale of infant development, this is the western scale, then Indian version of this particular scale is a Baroda developmental screening test, then developmental assessment scale for Indian infants, which is again devised by the Madam Phatak, and that is being abbreviated as DASI or DASII, that means developmental assessment scale for Indian infants. This is again a Baroda based scale. Now, in short about Baroda screening test, the Pramila Phatak is a psychologist. She has developed the Indian adaptation of this Bailey scale of infant development. There are 25 test items and listed according to the child's age, 0 to 30 months. The gross motor, fine motor and cognitive domains are evaluated. Administration time is 10 minutes and sensitivity of this particular test is from 0.66 to 0.93 and specificity is from 0.77 to 0.94. So, this is the about the Baroda screening test. Then this Trivandrum development screening test, another test, Indian adaptation of the western scale. So, based on the Baroda test norms, and it has got 17 test items. Gross motor, fine motor and cognitive domains are evaluated here also. Administrative time is only 5 minutes, because for a community survey the time is very important. So, 5 minutes screening test is used and validity is 0.67 to and the specificity is 0.79, and these are the various 17 items which are being used by this scale. This is what is the chart which is being used in the Trivandrum developmental screening chart or screening test. This particular chart is being used to find out, and it gives us the assessment of the child in the 5 minutes time. Now, developmental quotient is computed using the formula, the developmental age from the this particular test divided by the chronologic age, and it is multiplied by 100. So, that becomes a developmental score or developmental test. So, developmental quotient is used for child below 3 years of age, because the intelligence cannot be tested at a child below 3 years of age. It is particularly named as a developmental quotient, and when the child's intelligence is to be measured say beyond 3 years of age, then it is called as intelligence quotient, and the mental age divided by chronologic age multiplied by 100, that gives the score, and depending upon the score they are being graded. So, for older children 3 to 15 years, the various tests which are used as an intelligence test, they are good enough drawman test. Drawman test is nothing but a paper and pencil test, where a child is offered a paper and pencil, is asked to produce draw a picture of a man, and depending upon the parts he can draw, the scoring is done. That is called as good enough drawman test. Another is Vinayland social maturity scale. That also is a very specific test which can assess the social quotient of this particular child. Then Wechsler scale of child development. Then Mullin scale, Indian adaptation of the Wechsler's intelligence scale for child development. And this intelligence scale score may be repeated for verification and compatibility with the clinical scenario. One should not go only with the screening test, but one should try to see that whether it is correlating with the child development. And depending upon the amount of quotient, they are being graded as normal when it is quotient is between 90 to 110, borderline when it is 70 to 90, mild to or educable, what is it called as 50 to 70, and moderate or trainable is 35 to 50, and severe when it is between 20 to 35, and profound when it is below 20. So, these are the various ways of grading depending upon the score. So, the last but not the least, the message is development in a child is a very dynamic process of maturation of various skills. Sometimes we say that a child who is brought at the age of 6 months, mother says that my child is not sitting, my child is not doing as compared to that of the other child, the neighbor's child is able to even stand and walk at the age of 6.5 months. And then you are in a questionable position that why this is so. So, when you try to assess it, and then you find that that particular child, reference child, may be either a normal child or may be an abnormal child. But unless you follow this child, if you follow the same child at 9 months or 10 months and you find that there is an improvement, then this could be a normal variation, and therefore this child should not be labeled right in the first sitting as an abnormal child. So, the re-evaluation is very much essential before labeling a child as a normal or abnormal if he is being blamed. So, controlled by this development is controlled by so many factors, genetic and environmental factors and epigenetic factors. Routine screening is essential to know normal from aberrant development at various places, right from school entry, right from healthy baby competition and so on. And early detection, abnormality and implementation of corrective therapy can prevent lifelong handicaps. So, if you introduce the corrective steps right in the early life, before the child is being left to a very handicapped posture for a long time, then the improvement can occur with various occupation therapies, physiotherapies, medical therapies and so on. So, the early detection is very important. Most of the abnormal development is due to remediable conditions and they are amenable to various types of therapy. Developmental handicaps out of neglect should always be avoided. This is what is the last message. One should not be allowed to persist or maintain as it is. So, this is all about developmental assessment in a child and its importance in day-to-day life. Thank you very much.